Good afternoon. This is my medication administration. A subcutaneous injection. My ID. So I'm going to start off with an environmental scan. My workspace. Okay, what I have on my desk is a blank sheet for some calculations. Calculator and pen. Blank worksheet. Medication, patient chart, and my policies and my classification. I'm going to start off by my drug classification. So it's enoxaparin. It's an anticoagulant, antithrombotic, unfractured heparin, a low molecular weight heparin. Common side effects include fever, confusion, nausea, hemorrhage from any site, hyperchromic anemia, thrombocytopenia, injection site hematoma, hyperkalemia, and renal failure, edema, osteoporosis, angioedema, and anaphylaxis. Dosage range is 1 milligram per kilogram every 12 hours. Post-op for 7 to 10 days until DVT risk is diminished. Onset is between 15 and 30 minutes. The duration is 12 hours, and the peak is between 3 and 5 hours. So nursing implications include monitor the blood values, assess patient for bleeding, anaphylaxis. I want to monitor the blood pressure and vitals, and monitor the site given for hematoma or any edema. So looking at my medication policies, first I want to be sure that I'm qualified to give this medication. I also want to ensure that the order is correct, including all 9 identifiers: the strength, concentration, route of administration, frequency of administration, duration of administration, reason for use, the doctor's signature, the dose, the name, the date, and the time the order is to be given. So I'm going to go right into my patient's chart and just looking for any relevant data that would apply to this patient or giving this medication. So the patient's name is Sid Garland. He's a 54-year-old male being admitted to the hospital for below-the-knee amputation of his left leg. Mr. Garland is 3 days post-op, tolerated surgery well, but is experiencing complications due to infection. Mr. Garland's diabetes is unstable and wound healing is impaired. Mr. Garland is experiencing increased pain at wound site. Past medical history includes type 2 diabetes, myocardial infarction 2 years ago, neuropathy, coronary artery disease, asthma. So again, this patient is 3 days post-op, reports pain 5 out of 10 on the pain scale in the right calf. Started morphine yesterday for pain, also receiving oral analgesics for breakthrough pain. Patient is continued on anticoagulant therapy for DVT. Also complains of nausea with 3 episodes of vomiting since starting ceflazolin. Patient is started on antiemetic. He has a full coat. All of his vitals here look within the normal range. I'm still reporting 5 out of 10 on the pain scale. Calf remains swollen and warm to touch. Patient is to continue on anticoagulant therapy. While looking at the blood lab values, I noticed that his white blood cell count is high, 16.7, which should be between 4.0 and 11.0. Coagulation, PT is low. It's 1.45 when it should be between 1.5 and 2.0. So I'm going to go into signing off my signature sheet with the date. So the 7th of August, I want my name, my status, I'm an RPN student, my signature, and my initials. Okay, right away I'm going to compare my doctor's orders to my MAR. And for Sid Garland, ID band is 344316, 344316. His birthday is 11/08/1965, 11/08/1965. The doctor's name is on the MAR and the order. Patient is allergic to penicillin and codeine. The drug we're giving is enoxaparin. Enoxaparin, the dose is 1 milligram per kilogram. 1 milligram per kilogram. It's a subcutaneous injection. Frequency is every 12 hours. Special instructions are patient is to be weighed weekly. There are 2 times for this medication to be given: 0900 and 2100 hours. The 0900 has not been given yet, so that's the medication we'll be giving to continue DVT therapy for below-the-knee amputation. So at this point, I also want to just voice any pre-assessments I've made prior to giving this medication. Patient's not suffering any renal failure. That would be contraindicative of this drug. He's also at risk for bleeding due to his diabetes, and any medications that he's currently taking does not contraindict this drug. So at this point, I'm going to do some hand hygiene, and I'm going to go over to my med cart and just grab my supplies. Okay, so I have some gloves. I have my syringe, blunt-filled needle, some alcohol swabs, and the medication. First thing I want to do is check the expiry date here, which is 09/2028, and that's perfect. And I'm going to go right into my first check, comparing my medication label to my MAR. This is for Sid Garland. It's enoxaparin. The dose is 1 milligram per kilogram. What I have on hand is 100 milligrams per milliliter. The route is subcutaneous. The site will be in the abdomen. Frequency is every 12 hours. Time to be given is the near 0900 time, because it has not been given today. I'm going to go right into my, the reason is to continue DVT therapy for below-the-knee amputation. I'm going to go right into my second check. So it's for Sid Garland. Drug is enoxaparin. Dose is 1 milligram per kilogram. What I have here on hand is 100 milligrams per milliliter. It's a subcutaneous injection. Site is the abdomen. Frequency is every 12 hours. And again, we are giving the 0900 dose because that has not been given yet. And the reason is for the patient to continue DVT therapy for a below-the-knee amputation. So I'm going to do some calculations, and it's all based on weights and the order. So the patient's chart states he weighs 55 kilograms. Order states it's 1 milligram per kilogram. So I'm going to multiply 55 kilograms by 1 milligram equals 55 milligrams. That will be my dose. For my volume equation, it is dose over what I have available times quantity. So my dose is 55 milligrams. What I have on hand is 100 milligrams. Quantity is 1 milliliter, so multiplied by 1 milliliter. So 55 divided by 100 times 1 equals 0.55 milliliters. That is my volume. So I would have done hand hygiene before I had taken any of this stuff out, and I'm going to do it again now. So first I'm going to clean off the port of my medication. Also, after I had done my math, I will have called the teacher over for an independent double check. No, I'm sorry, I'm not there yet. So I'm going to clean my port of my medication off. I'm going to open all my supplies, trying to maintain sterile asepsis. Okay, so I'm going to pull out my syringe and attach my blunt-filled needle. Pulling off the cap, I'm going to inject a little air. Insert that air into my jar. So I'm going to want to draw up 0.55 milliliters. Also injecting a little extra to leave room for my priming of the needle. Okay. I'm going to recap. Putting this in my sharps. I'm going to maintain sterile asepsis by attaching my injection needle. I'm going to want to rid of any air bubbles. I'm going to prime my needle to my dose or volume of 0.55 milliliters. And now I'm going to go straight into my third check. This is for Sid Garland. Sid Garland, the drug is enoxaparin. The dose is 1 milligram per kilogram. What I have on hand is 100 milligrams per milliliter. After calculations, have determined that it is 55 milligrams is the dose, and the volume is 0.55 milliliters. So this is a subcutaneous injection. The site is in the abdomen. Frequency is every 12 hours. And the time we're giving is the 0900 dose. It has not been given yet. And the reason is for the patient to continue DVT therapy for below-the-knee amputation. Now, at this point, I will call my teacher over to do an independent double. No. I'm going to flip my math over and redo my calculation. So 55 kilograms, patient weighs. Order states it's 1 milligram per kilogram. So 55 multiplied by 55 kilograms multiplied by 1 milligram. So equals 55 milligrams. My volume equation is dose over what I have available times quantity. So my dose is 55 milligrams. What I have available is 100 milligrams. Quantity is 1 milliliter. So 55 divided by 100 times 1 equals 0.55 milliliter. That is my volume. Now at this point, I will ask my teacher to come over and do an independent double check. Here's my math. Here's my syringe. Okay. So before I go into the patient's room, I'm going to gather all my supplies needed, and I'm going to do some hand hygiene. So I have my syringe, my gloves, and my alcohol swab. I will have cleaned everything up as well. I'm also entering with my worksheets so I can verify my patient. At this time, I want to introduce myself as Caitlin Jarvis, a nursing student at Durham College. I want to let the patient know what I am here for, to give his enoxaparin 9 a.m. dose, and I also want to gain consent. Patient agrees, so I'm going to just verify my patient by looking at the wristband, comparing it to my worksheet. So Sid Garland, date of birth is 11/08/1965, 11/08/1965, MRN number is 344316. Date of birth is MRN is 344316. And I also want to ask my patient if he has any allergies I should know about. Patient states he's allergic to penicillin and codeine. I want to ask what type of reaction he has when introduced with these medications. And I also want to assess the previous site that this has been given. It's a subcutaneous injection, and we want to re-rotate the sites. The previous site was given in the right middle quadrant, so I'm going to assess that site for any nodules, any swelling, adverse reactions to the injection. I see none. So I'm going to move over to the left middle quadrant, do some hand hygiene, put my gloves on. I'm going to want to clean the site of injection. And because this is a subcutaneous injection, it can go from 45 to 90 degrees. This will depend on the amount of subcutaneous tissue this patient has. He's got copious amounts, so we'll go in at 90 degrees. So when I'm cleaning the injection site, I'm going to want to go in a circular motion, left middle quadrant, 2 inches out from the injection site. I'm going to let that air dry. I'm going to grab my needle in my dominant hand and pinch the folds of the skin with my non-dominant hand. So again, we're going in at 90 degrees, pinching with my non-dominant. I'm going to go in sharp and fast, and I do not want to aspirate for any blood. I'm going to give the injection slow. Continuing to hold the folds, I'm going to remove my needle. I'm not going to massage that site. I'm going to recap my needle, and I will dispose of this into the sharps container beside the bed. At this point, I'm going to remove my gloves, and I'm going to provide the patient with some health teaching. I want to let him know just to be careful while shaving, just to not, he's at risk for bleeding, so I'll try not to nick the skin at all. And I also want him to be careful while clipping his nails, just to, reduce any unnecessary bleeding. So I will have done an environmental scan before I had gone in this room as well, making sure his O2 stat and his suction was working. The bed was in the lowest position, free of clutter and all that. And as well, when I leave, I'm going to do the same thing, making sure the bed is in the lowest position, brakes are locked, that he has the call bell in hand, free of clutter. And I also want to come back in between 15 to 30 minutes just to reassess my patient. I want to assess his vitals. I want to assess the site for any bleeding or any adverse reactions, allergic reactions. And I will leave my patient's room, dispose of any sharps, and do some hand hygiene. And I will now document at my 9 o'clock spot on my MAR. Okay, the 8th of August, 2020, I sign my signature, and I'm going to call over my instructor for a cosign.